Please excuse this interruption. New York Governor Andrew Cuomo is set to make an announcement shortly after the news broke that a third person in our area has tested positive for the coronavirus. Let's go ahead and listen in.
Has also tested positive. His daughter has tested positive, and his neighbor who drove him to the hospital also tested positive. The son is 20 years old and attends Yeshiva University. The daughter is 14 years old and is in the SAR school. And the neighbor is not just a neighbor, but actually drove the attorney to the hospital and therefore was in a car with the attorney in that closed environment, and the neighbors tested positive. That then triggers the detective work where we go back and we try to make as many connections as possible and do as much research and investigation as possible, and then notify people, right? Whenever you find a case, it's about containment and doing the best you can to keep the circle as tight as possible. The head of Yeshiva University I spoke to this morning, and the school that the son attends will be closed for today. The SAR school is also closed for today. We are going to meet in Westchester this afternoon at noon with the heads of the schools and the county and the local health officials to get some more facts and start to track back to the best we can. I also want to announce that we're going to recall SUNY and CUNY students from study abroad programs in 5 countries: China, Italy, Japan, Iran, South Korea. Those are countries that have been on the quote-unquote watch list, recall list that the federal government has set. The students will come back on a chartered plane, which will land in Stewart Airport. They will then be quarantined for 14 days in dormitory settings. We'll then stay in touch with them after the 14 days to do follow-up work. On all of this, the context is what is most important, and we have an epidemic caused by coronavirus, but we have a pandemic that is caused by fear. Now, what causes fear? Only 2 things. People get afraid when either they think they don't have the right information, or they don't trust the information they're getting, or the information they're getting is so frightening that they have the normal reaction. I think in this case, people are suspect about what they're hearing, because government now is so polarized in so many ways. The environment is so political that you hear different messages about this situation. And then it gets politicized. The Democrats say the Republicans are trying to minimize it. Republicans say the Democrats are hyping it. So I think it's very important here in New York that I provide the factual information to people so they know these are just the facts. The second point is, once you accept the facts, there is no reason to be frightened by these facts. Remember the context. You have to take a step back. There are going to be many, many people who test positive. By definition, the more you test, the more people you will find who test positive. If you went out and started conducting tests for the flu virus, you would find more people who have the flu virus, who are walking around and didn't know that they had it. Then you start testing, you're going to see the number go up. We know what this coronavirus is. We've gone through it in China. They're going through it in other countries. We know what it is. It is easily transmitted. But 80% of the people who get the virus will self-resolve. The other 20% may be medically ill and even require hospitalization, in which case we have that capacity. And the lethality rate, according to CDC, is 1.4%. 1.4% compared to 0.6% for the normal flu. And again, these are just estimates. Sometimes the 0.6 is a little higher, a little lower. Sometimes the 1.4 is a little higher, a little lower, 1.2. But it's roughly double the flu rate. And the people who we are most concerned about, who are most vulnerable, are senior citizens, people with immune compromised situations. Those are the people who are most vulnerable. What we're worried about, nursing home setting, senior care setting. That's what we've seen in other places, and that's where the situation is most problematic. And if you look at what's even happening here in New York, it confirms that. The 39-year-old healthcare worker who came back from Iran, who tested positive, she is at home, has not been hospitalized, and she's getting better. Her husband, who didn't turn out testing positive, he is getting better. The 50-year-old attorney in Westchester, he had an underlying respiratory illness. So he is in the category of people who we worry about in this situation. But those are the facts. And if you understand the facts, there is no reason for undue anxiety. We're now in this loop where, well, we're testing one person, two persons, three. There are going to be dozens and dozens and dozens of people. And the more people you test, the more people you're going to find. So that is the situation, and let's just keep that in mind. And when you ask the CDC, well, what's the variable on how many people this virus is truly dangerous for, they say it depends on how well the healthcare system operates. China was close to 2%, but China did not have an existing state-of-the-art healthcare system compared to the United States. When China started to do better, it dropped from 2% down closer to 1%. So the level of healthcare and the quality of healthcare is very important. Luckily, here in New York, we have one of the best healthcare systems on the globe, period. And we are doing everything humanly possible to improve even on that. So with that, let's take a couple of questions, and then we're going to go down to Westchester and come up with a local strategy. Hold on, I'm sorry.
How are we branching out the testing process now, given these 5 cases? Do we know, did the 14-year-old go to school? Do people there need to be tested? Are they being monitored? From these 5 positives, how are we branching out?
Yeah, well, that's exactly what we're going to Westchester to have to discuss, because it becomes a very fact-specific investigation to answer just those questions. In the meantime, the SAR school is closed, which is the school the daughter attended. Yeshiva University is closed, the school that the son attended. I spoke to the head of Yeshiva University this morning. We said, let's close the school, let's come down and start to track everything back and see where we go.
The WHO said yesterday that the mortality rate, if you include the outbreak in China, is about 3.4%. I'm just curious, is there a discrepancy?
I think what they said, Zach, and these numbers do bounce a little bit. I think what they said on the 3.4 is, I thought that was a global estimate, and the variable is depending on the country you're in and the quality of your healthcare system. There will be countries that do not have the healthcare capacity, where you won't be able to get people into a hospital bed, that don't have the same level of care, where you'll have a higher mortality rate. because the healthcare system will not be able to handle it. Their point on China was it was closer to 2% when it started because China was not ready to handle it. As they came up to speed, that started to drop. Our healthcare system is better. But I believe the 3.4 was their global estimate, not a U.S. estimate. Do you know that? Is that right?
Governor, could you explain more about the...
You can say that I'm right. I like when you say that I'm right.
Governor, could you explain more about the dormitory setting and the quarantine? Is this a hospital, a nursing home, a specially set up temporary...
The SUNY CUNY,
For the
the 300. For the SUNY CUNY, there are 300 SUNY CUNY students and related faculty in those 5 countries. They will come back. We're identifying dormitory facilities for them, which will be controlled facilities for the quarantine period. Is there anything else on that, Beth?
There's no place designated just yet. You're still working on that?
We've identified excess capacity where there are not currently other students who are already living there. So we've identified spaces near Long Island. We've identified spaces out in Western New York and in the Utica, Rome area.
What's the testing capacity at this point for the state? Is it still limited?
The state, well, there are no simple answers to these questions. State has testing capacity in the state lab. City government has testing capacity in the city-owned lab. The maximum capacity is going to be the utilization of private labs or hospital labs. Northwell has a major lab, Mount Sinai has a lab, Columbia Presbyterian has a major laboratory. So we're creating a network of those private labs working with Wadsworth. And as I said, we want to get the capacity of the testing up to about 1,000 per day. We're not there yet. Part of it is you need not just the laboratories, you need agents that are part of this particular test, chemical agents, and we have to secure those agents. Anything you want to add on that, good doctor?
This gets back to the Westchester case.
Are you impressed with my health knowledge?
I am impressed.
The Westchester case, just want to get back to that. Yesterday, the county health department said they're going to self-quarantine everybody who was at that temple, who were at shul there over the prior weekend, or who might have went to bar mitzvahs or funerals where they might have come in contact with the Westchester attorney. Do you know, I mean, that sounds like a pretty large number of people. I mean, do you have an estimate of how many people that is going to be?
Yeah, Joe, we're going to have the meeting this afternoon, and that's going to be one of the questions.
I know you're starting to get your arms around it, but at what point does this grow to a point where you can't quarantine thousands of people all in different parts of New York?
Yeah, you are exactly right. At one point, you can't trace the cord back anymore, right? And then you wind up in a situation where remarkably it comes full circle, and you basically wind up saying to people, you would do what you would do if you thought you might have the flu. Just be hyper cautious. If you started to have some symptoms, rather than saying, oh, you know what, I'm going to go into work anyway. Don't go into work and stay home, right? What is self-quarantine? Self-quarantine is stay home if you're not feeling well, or if you have symptoms, in this case, or if you had close contact with an individual who you know tested positive. Err on the side of caution, stay home.
It seems like you're still at that containment point here, where you, in the case of Westchester or with Yeshiva, you're still trying to keep people from
You will
going out.
always be in the containment phase, where whenever there's a case, track it back, track it back. Well, the universe is so large, I know, track it back. It's not a perfect science. But it does put a population on notice. And then there's always right, this goes in concentric circles. There's an inner core group of people who were extraordinarily close to that individual. The neighbor drove the person to the, that's my roommate. I went to dinner with him last week, right? That's a different universe. And obviously, the closer the concentric circle, the more care you take. Want to add something, Doctor?
I think that this is where epidemiology does that forensic look in trying to track people back. And it's.
Yeah, the latest on his condition, he was changed to critical yesterday.
Well, he's still in the ICU right now.
How serious is his situation?
Well, anyone in the ICU is usually critical.
But Joe, he has an underlying respiratory illness, right? So when we talk about the vulnerable population here, senior citizens, immune compromised, or an existing underlying illness, especially an underlying respiratory illness, because this is a respiratory disease, this gentleman fits in that category.
What are the plans in the event of an outbreak in New York City, like a full-on?
Well, full on, it would be a virus that people get. 80% of the people wouldn't know that they had it, basically. They would be walking around, they would think they had some symptoms, and they would self-resolve. That's 80%. Some percentage would feel sick enough, and especially now with this fear, where they would go to a hospital and get medical help. And then the real question that people want to know is this deadly, right? They have Ebola in their mind. And by the way, Ebola was a much, much, much more deadly virus than this. And then you have the potential, depending on how well you do as a healthcare system, of a lethality rate, mortality rate of 1.2, 1.4%. Well, what does that mean? The normal flu is 0.6. We have 15,000 people in our hospitals today who have the flu. 15,000. So it's the hyper-awareness about this. The more you test, the more positives you will find. If you never tested, then yes, it would increase and it would run its course. What the testing does for you is it allows you to reduce as much as possible the exposure.
So of the six patients we have, so we've got 4 in the family, the neighbor, and the healthcare worker from Iran. Only the attorney is hospitalized?
That's correct.
So the family and the neighbor, they're at home? And do you have any update on anyone else's condition, including the healthcare worker? What is her condition?
The healthcare worker is doing better.
But see, guys, that is the point, right? So we have 6 cases in New York. Only 1 is hospitalized. Who is hospitalized? The 50-year-old attorney who had a respiratory illness, which was the underlying illness that we were talking about that puts you in that targeted, vulnerable population. Where are the others? They're home. They're on, we call it quarantine. Yeah. Different context, you'd say they're home with the flu, right? But now we call it you're home on self-quarantine. The healthcare worker, 39-year-old woman, never went to the hospital, and she's now feeling better. So that's the context that is appropriate and truthful and determinative here.
What is the infection rate? Is it tracking differently here than, say, China or some of these other countries? Like per person?
Well, we don't know exactly the infection rate, even in China, because as the governor said, there may be a lot of individuals who are sick and never showed up in the healthcare system. But usually viruses, they're going to, unless the virus completely changes, it's going to be the same as it spreads from one person to another, whether it's in Europe, Asia, or the United States.
So this lawyer's underlying illness wasn't the virus. It was his respiratory condition or?
Go ahead.
Sure. So he had an underlying medical condition, a respiratory condition, and anytime you have an infection that happens when someone has a medical condition, particularly as the governor mentioned, a lung condition, you're going to get symptoms that are going to be a lot worse, and obviously you could be sick enough to end up in the hospital or in the ICU.
At what point are New Yorkers who think they have the virus being tested? Is the state abiding by the CDC guidelines that I think Vice President Pence said recently that he wants to loosen, or what sort of parameters is the state using to test people who think they might have the virus?
So we are working closely with the CDC. In fact, I was on the phone with the CDC only a couple minutes before I walked in here, and we've working with their recommendations of what they have put forth so far.
So what do those parameters look like? You have to think you feel ill and know of someone who had the virus in order to be tested?
So I think this brings up the concern about the worried well. There are a lot of people out there who have a sniffle or cough, and they think that they have coronavirus, and it's really important to alleviate some of those worries or fears. They may just have a cold, regular cold. And there are criteria that have been put forth regarding the travel of those who are coming back to the United States. Individuals who are sick and symptomatic should talk to their healthcare professional and find out, because they may have either an underlying reason for having that cough or that symptom. They may have been put on a medication, which some medications give you a cough. And so it's really important to talk to their doctor or their nurse practitioner, whoever cares for them, about that.
Do we know if any of these
No.
positive cases have any of these individuals taken Metro North or the subway in the city?
We don't know. We're going to have that conversation in Westchester.
That $40 million that you signed yesterday, is some of that going to go to the counties? I mean, you see the counties are dealing with a lot of this as well on the local level.
Joe, we kept it flexible because we don't really know where the need is going to be now. Also, on the virus outside of the body, best information is it can only live a number of hours, right? So, again, perspective, context. Okay, we're going to go to Westchester. Thank you very much.
We've been watching Governor Cuomo, who said 3 more people have tested positive for the coronavirus in our area. The latest patients are the wife, 14-year-old daughter, 20-year-old son, and neighbor of an existing coronavirus patient from New Rochelle. All were exposed to the man who's in his 50s. His neighbor drove him to the hospital. As a result, Yeshiva University and the SAR school, where both children attended, have closed today. Now the investigation into who the new patients have had contact with continues and will likely lead to many more people being advised to self-quarantine. Add to that, SUNY and CUNY students are now returning home from study abroad programs in the affected countries. Now, the governor called the coronavirus crisis an epidemic, but said there is no reason to be frightened. Many more positive cases are expected. However, a vast majority of people recover from the diagnosis. Now, if you think you've been exposed, do not rush to an emergency room or urgent care facility. First, call ahead or call the hotlines that have been established. Now, we'll have that information and much more on our website, cbsnewyork.com. Right now, we're taking a quick break. We'll be right back right here on CBSN New York.